Konstantina Bumaki was just 9 years old when her world changed forever. Diagnosed with type 1 diabetes, she was suddenly thrust into a world of needles, blood sugar checks, and dietary restrictions. It was overwhelming and confusing for such a young child. The diagnosis was a shock, a sudden shift from carefree childhood to a life defined by a chronic illness. Her parents were equally stunned, grappling with the new reality and the constant vigilance required. Yet, even at that young age, Konstantina possessed a resilient spirit. She faced each day with a determination that belied her years. She was determined to not let diabetes define her, to live a full and active life. She continued to play sports, run around with friends, and enjoy the outdoors. Amidst the challenges, Konstantina found solace and strength in the compassion of certain healthcare professionals. Their support was a beacon of hope in her new, complex world. These individuals, with their kind words and empathetic approach, left an indelible mark on her journey. They provided not just medical care, but emotional support that was crucial for her well-being. They saw beyond her diagnosis, recognizing her as a young girl navigating a difficult path. Their understanding and encouragement were invaluable. Their empathy fueled her spirit, reminding her that she was not alone. With their help, Konstantina learned to manage her condition and embrace life with optimism and courage. Throughout her journey, Konstantina encountered healthcare providers who truly understood the emotional toll of diabetes. They were not just focused on the clinical aspects of her condition, but also on her overall well-being. One doctor, she recalls, always took the time to ask how I was coping, not just how my blood sugar was doing. This simple act of asking about her emotional state made her feel seen and valued as a person, not just a patient. These interactions, imbued with empathy and genuine concern, made a world of difference. They were not just routine checkups. They were moments of genuine human connection that provided her with much-needed emotional support. They empowered her, reinforcing her belief that she could not only manage her condition, but thrive despite it. This empowerment was crucial in helping her maintain a positive outlook on life. These positive experiences with empathetic healthcare professionals fueled Konstantina's desire to pursue a career in medicine. She wanted to be a beacon of hope and support for others facing similar challenges. She was driven by a deep-seated desire to provide the same level of compassionate care that she had been fortunate enough to receive. Her goal was to make a meaningful difference in the lives of her future patients. "I want to be that source of support for others," she shares, "to offer not just medical expertise, but also a listening ear and a compassionate heart." Her journey is a testament to the profound impact that compassionate care can have on a person's life. However, not all of Konstantina's experiences were positive. There were moments that left her feeling more isolated than ever. She also encountered healthcare providers who seemed more focused on numbers than on the individual behind the diagnosis. It was as if her humanity was overshadowed by clinical data. It felt dehumanizing, she reveals, to be reduced to just my blood sugar levels. The lack of personal connection made her feel like just another case file. These encounters, marked by a lack of empathy and understanding, left her feeling disheartened and misunderstood. The emotional toll was significant, adding to the burden of her illness. These negative experiences highlighted a crucial gap in diabetes care: the lack of attention paid to the psychological and emotional well-being of patients. It was clear that something was missing in the approach to her care. Konstantina realized that managing diabetes went beyond simply controlling blood sugar. It required addressing the emotional and mental health challenges that came with living with a chronic illness. She understood that true care involved seeing the person, not just the patient. Konstantina firmly believes that psychological support is not a luxury, but a necessity for individuals living with diabetes. The daily burden of managing this disease takes a toll, she emphasizes. The constant monitoring, the fear of complications, the impact on daily life, these factors can lead to stress, anxiety, and even depression. This realization fueled Konstantina's passion for advocating for integrated care teams. She envisions a future where psychologists are an integral part of diabetes care, providing patients with the tools and support they need to navigate the emotional challenges of their condition.